Hi, so welcome to Angie Tells All. This is my pregnancy update. It's a little overdue. I am now almost 26 weeks. I'm 25 weeks and 4 days. So, from the last time I posted a video till now, I have gotten two really bad colds. I've had a UTI that I had to have treated 3 different times. Um, my wisdom teeth became infected. So, and that was really interesting because I don't have any top wisdom teeth, but I have bottom ones, and this one has never caused me any problems. So I started feeling some discomfort and kind of like an earache, but not like it was hurting like around my ear, but it wasn't like a full on like throbbing earache situation. So excuse me, I kind of left it and I was like, well, I'll wait and see what happens because my throat was a little sore too. So I thought it was a cold. And like right when I thought I was just going to leave it for a couple more days and then go in, I woke up the next morning and like this side of my face was like blown up and it was hurting. I have a really high pain tolerance, so it was hurting, but I mean, for me, it really wasn't like that much pain, but it was enough pain for me to know, like, yeah, there's something going on. And I still haven't been in to see the dentist. I see the dentist on April the 7th. I was supposed to see the dentist a couple days ago, but when you're pregnant, you have to have a clearance, like if you have any dental work to get x-rays done. So I thought I had the paper in my purse and we left and we were like 4 minutes into the drive, but my husband was taking me to this appointment and we left like right in time to get there without like any time buffer type of situation. Um, which to be fair, I could have been a little more prepared on my side as well, and I wasn't. So enough said on that. But anyway, we were like 4 minutes into the drive, and then I realized I didn't have the papers. I had to call them and be like, I'm sorry, I can't make the appointment today because I don't have that paper. So they rescheduled me. So now it's April the 7th. So I had those two um, colds, the UTI, the wisdom tooth infection, and both of them were getting infected. I have since switched mouthwashes, and I think that's helped. Like, I'm using Listerine. So, just FYI, if you are pregnant as well, um, I would be, and I always like I floss, I brush twice a day, I floss once a day, I do mouthwash like twice a day. So that's like my normal like dental hygiene routine, if you will, even outside of pregnancy. But just an FYI, if you are pregnant, like that type of stuff is really important because you're more predisposed to getting types of infections like that and having, precursors to gum disease and stuff like that if you're pregnant. So I highly recommend Listerine. I've used Listerine before, but I kind of like switched to like the off brand just to save a little money. Listerine does make a difference. Um, so if you're looking for a mouthwash, even if you aren't pregnant, if you're looking for a mouthwash, quiet. Sorry, my dog is. It's thunderstorming and my dog has an issue with thunderstorms, so he's like laying in my bed like freaking out. So if you're whining, that is him. You're fine. I know, buddy. I'll get you one of your calming chews in a little bit, okay? Oh, good boy. Um, quiet. But whining isn't gonna fix it, buddy. It's still gonna be thundering. I'm sorry. It'll be done soon, okay? He's looking at me like, why are you leaving me here? Like, why aren't you doing something about the situation? I'm sorry, buddy. In any case, back to what I was saying. Listerine is a very good mouthwash, so I highly recommend it, especially if you're pregnant and you are looking for something that will help you just keep up correctly with your dental hygiene needs. So those were my issues, and I did not feel like doing a video, and I mean, I want to document this. Like I've said before, this is more for my own. I mean, if someone watches these videos and gains some insight or helpful tips, that's great. That's fabulous. But this is more for my own documentation because I'm 43. This is my last pregnancy. Definitely my last pregnancy. Like, I don't want to be pregnant again, but I also kind of want to document the experience and the journey just so I have something to look back on and for my own memories and purposes, personal reasons, I guess. So that was that. And then updates since then. So I was referred to maternal fetal medicine because I am 43 and I've had some high risk stuff happen in the past. So they went ahead and referred me to maternal fetal medicine. I had my anatomy scan. The anatomy scan went fine. There were no issues with that, thankfully. At my regular OBGYN, I had an anatomy scan, but I also had a scan with maternal fetal medicine when I saw them for the first time. So, sorry if I'm fidgeting, but it's getting a little uncomfortable, I guess, to sit for long periods of time. Anyway, so I had my anatomy scan through my regular OBGYN, and then maternal fetal medicine also did a scan. Everything with the baby was fine. No issues there. No issues were found. He's growing fine, and I am grateful for that. But they did find that I had placenta previa, so that was the next thing. And I've never had that, so I was really concerned, like how it was going to affect me and my pregnancy. And so far, thankfully, I haven't had any issues. I haven't had any bleeding. It was considered partial placenta previa, which, if you don't know what placenta previa is, I should back up and explain that. So placenta previa is when the placenta, which of course you probably know, the placenta is the organ that supports the baby. It removes waste, it gives blood flow and nutrients to the baby. So when the placenta, which is attached to your uterine wall, covers your cervix, is called placenta previa. And there's different grades of it, so you can have it where it's entirely covering the cervix, or it can just be partial. It can be marginal, which is like not actually covering the cervix but like beside the cervix. So mine was diagnosed at the first scan as partial placenta previa, so it was covering the cervix but not the whole cervix. And then a couple days ago I had a scan and it's now marginal, which means it is adjacent to the cervix, but they want like a 2 centimeter leeway, like 2 centimeters away from your cervix, and you can deliver vaginally. If it doesn't move, then you have to have a C-section. It's not up for negotiation. Like, you have to have a C-section. You can't vaginally deliver if you have placenta previa. So mine had moved because it went from partial to marginal. And that's the thing, as you continue through your pregnancy and things grow, the placenta kind of will like usually move upward. So a lot of the cases do resolve. So I'm hoping by the next scan it will be out of the way, because even with marginal placenta previa, there's still restrictions. You're on pelvic rest, no intercourse, no heavy lifting. I'm not supposed to be on my feet more than 2 hours. It's just a thing. So that happened, and that was another additional diagnosis. You're okay, buddy. I know, it's storming. I'm sorry. It's gonna be okay. I'll go get your calming chew in a minute, okay? Oh, dogs. So I also had a urinalysis through maternal fetal medicine that came back with protein and creatinine, which can be a precursor to preeclampsia. My blood pressure has been fine so far, thankfully. but they're going to keep watch on that. Now, they did do, good boy, good quiet. They did do a urinalysis and a culture when I was there a couple days ago, and I did get the results that there was no protein found in that sample, which that's good. So I was excited about that. And then I did have a follow up with the pulmonologist. So I was seeing pulmonologists for issues I was having before pregnancy. That's kind of like, I don't I don't even really want to go too deep into that, but that situation is still ongoing. Um so further testing for my issues outside of pregnancy would be a muscle biopsy, but I can't have that done while I'm pregnant. So I'm going to have to wait until after to be able to get that done. And I kind of already released the gender in this video, so I may as well say it. It was like an accidental, like I used the pronoun. So that was unintentional, and I'm not going back and redoing this video for that, so I may as well just tell the gender. So we had a gender reveal. It wasn't like a party, it was just like a family celebration, but we are having a boy, so we found that out a while ago, and I do have some ultrasound photos. Let me grab those real quick. Actually, because I don't think I showed these in my, I don't think I showed any of these in my other, whoops, oh, stretch. Oh, that hurts. That's not comfortable. Okay. Yeah, so good grief, I can't even like, I'm trying to make sure I got them all in order. Because I actually have quite a few ultrasound pictures. Good grief. I'm trying to see if this says how far along I am in any of these. So I don't really want to show them out of order. I think this was my first one. I think this was my second, but I'll just put that over there because it's basically almost the same as the first. And then I think this was my anatomy scan. Well, like I say, I had 2 anatomy scans, so we'll just show them like this. I'm going to cover up my, try and cover up my information here. So this is the first. There's got to be a better way to cover that up because it's like I don't want people to know what hospital I go to in case other people are watching this. Let's see. Let me do it this way. Let me do it this way. So this is the first one. And then this one would be the anatomy scan. Make sure I have my data covered up. That's the anatomy scan. And then this was the anatomy scan for through maternal fetal medicine. So you can see his face there. And then These were the ones I just had done a couple days ago. Oops. Salem, you look so worried. Oh my goodness, I feel really bad because I'm just sitting here and I should have gotten them a chew before I sat down, but I didn't think of that. So this is actually the 3D, a 3D, and it's of his face, and he kind of has his hand like in front of his face. So that was a good one. And where's the other one that's 3D? She gave me 2 3D pictures. Let me fold this out of the way so. And this is another one of his face, 3D. So those are my ultrasound photos. Hopefully they're visible when I go to watch this. Let me put them back over here so they don't get messed up. I need to find a book to put them in and get them organized. So that was my ultrasound. My next appointment is with my regular OBGYN, which is on March the 30th, I think. And that's just going to be like a basic way, take your blood pressure. See, I don't want this to go over 20 minutes. Way, take your blood pressure, that type of thing. I don't know when they'll do the strep B thing, because I know they swab you for strep B, but I haven't had that done. I haven't had a pelvic exam because I declined the PAP in the beginning because I was so uncomfortable anyway. So I declined that. I'm gonna postpone it until my checkup after delivery. So I think for at least a few more weeks, 3 more weeks maybe, it might just be like weigh blood pressure, and they're probably going to be scheduling my second gestational diabetes check because I had the 1 hour that I passed, but you usually get checked again around 28 weeks, and I'll be 26 weeks on Saturday. So that will probably, I'm assuming that will be scheduled at the next visit. And other than that, I think that's all the pregnancy updates. Like I say, it is a boy. We have a name picked out, but I'm definitely going to wait to reveal that on here. I'll probably wait until maybe even after he's here. And I did get a maternity shirt, which this shirt is actually a maternity t-shirt, and my husband bought it for me. He bought me several. This one is one that I bought. I think this is the one I bought. Make sure it's the one I bought before I show it. I got this from Temu, and I don't need maternity clothes. Like all my pre-pregnancy stuff still fits, so I don't want to buy a bunch of stuff. Like if I need to buy, my husband actually bought me a pair of maternity pants as well. But other than the things that he bought, and the maternity pants he bought are too big, but that's fine. I've still been wearing them because they're comfortable. I mean, they don't like fall down because of my belly. Like my belly kind of keeps them up. But thankfully my pre-pregnancy stuff still fits even my shirts. So I wear that stuff, but I have been wearing like my t-shirts because it's getting warmer. And I got this t-shirt from Temu for like, I think like $9, $8 or $9. And it says baby boy loading. I thought it was really cute. I love the little feet. Oh, that's better actually. That's a better view. The little blue feet, and it's actually really comfortable. So that's the only maternity shirt that I've bought, and I'm hoping my stuff will continue to fit. I haven't really been eating a whole lot. I mean, I haven't been starving myself, but I haven't been like going overboard, so that's always a good thing. Um, we have gotten some baby clothes, and I'm trying to remember what I put in my last video. I think I've already mentioned the stroller and the car seat. We have that. And my husband, oh, some stuff is falling over, sorry. Oops. A lot of stuff is falling over. My husband bought a baby bathtub, so we have that. We have clothes, we have some sleep sacks. I still need to buy, we have some bibs, but I need to buy some more bibs and some more clothes. We need more sleepers, and I'll probably just kind of make a list for that. You really don't need a whole lot, especially newborn stuff, because they grow out of it so quickly. Excuse me, but we do need to get some more items so we have enough, because I mean, you don't want to be doing laundry every single day, and babies, make a lot of a lot of messes. So there's that. And what else do we have? Oh, my husband bought a dresser. It's more of like a nightstand situation, but it's got like hardwood on the top, but it has those kind of like fabric fronted doors. And I don't know if I'll take a picture of that or not. It's baseball themed, so the front cover of the drawers it's like a baseball field with like I think the home plate. It's neat. That I know that sounds really confusing, but that's what it looks like. Like the front is kind of like a baseball field. Like every single drawer has like part of the picture, I guess you would say. And he also bought him a clock, which is like a baseball. So those were cute. I like those, and it's very lightweight, so it'll be easy to move around. And then we have the pack and play bassinet crib combo thing. So that I think will be helpful because it has wheels on it so you can move it, and it also has organization space on it so you can put, diapers and things like that in it, organize it. And I think that's pretty much all that we've gotten item wise. We need to get the car seat in the car. I would like to have that done by like 30 weeks at the latest, but we still have some time. Like I say, I'm 26 weeks this coming Saturday, so, but it goes by quick. Like if you're pregnant, it goes by quick. Well, I should say for some people it goes by quick. For some, I guess maybe it drags on. I think it really depends on your personal experience and your own perception of time. But I mean, for me, like the first trimester kind of drug on, but after that, even with being sick and stuff, like it's gone by really quick, and I can't believe it's almost April, and I'm due June to July, so I'm over halfway. I'm over the halfway point, which is kind of crazy. Um, yeah, so I will be packing my hospital bag sometime, and we'll be doing our tour of the hospital, the birthing center. So all of that stuff will be coming up, and like I say, I'm over halfway done. So that is my tell-all for whatever week I was. I can't even remember what week I was in the last video. I can't. I can't. Like I'm fried. I'm totally fried. But that's my update from my last video up until 26 plus 4 weeks pregnant. I will try to get another timely video updated because I really don't like the huge gaps, but I mean, things happen, so what can you do? But this is Angie Tells All, and I think I have 2 subscribers. I was not even expecting to have any subscribers on this channel. Like I say, this was just for my benefit because I have another YouTube channel, but it's more, I didn't want to cloud it with my pregnancy stuff because it's not even about that. And I don't even have a lot of subscribers over there either. Like, I think 33 now. Um, some of my videos over there have been gaining some traction, but I don't upload regularly. Not because I don't want to, but because, like I say, everything happening, I just have not been able to. I have plans and like things that I want to put over there, but I didn't want to cloud it with my pregnancy stuff. So this was just my space to vlog my experience. So the fact that I have 2 subscribers is kind of cool. And hopefully, if you're watching this, you get something out of it education wise. And if anyone has any questions about pregnancy or um, anything really, just feel free to drop a comment. And I will sign off for now. And this is Angie Tells All. I will catch you later. Bye bye.